The elderly are also really susceptible, and the elderly are being promised all kinds of cures and treatments, as we saw on the previous wheel, the leaf fly wheel, with all the diseases that it treats. A few of the promises are that it treats Parkinson's, treats Alzheimer's, treats cancer. The American Neurologic Society does not recommend it. The Alzheimer's Society does not recommend marijuana in treatment of disease. However, even here in doing some outreach talks, I talked to a nurse who was working in a small outlying city that said she couldn't get neurologists. So she was recommending that her elderly vulnerable patients or their families go to the marijuana store and buy THC products. So I asked her, I said, as the nurse, what dose do you recommend? And she shook her head, she didn't know. And I said, do you send your patients with a list of medications? Because even now we're realizing there's more and more and more medication interactions with CBD and THC. And she said, no. And I said, so in essence, you're turning the care of a vulnerable patient over to a bud tender who probably doesn't have any medical training. And that's the reality of what we're seeing here. In 1990 or at Woodstock, if you bought a joint, it would have 1 to 3 milligrams of THC. If you had a really good joint, it would be 3 milligrams of THC. Currently in Colorado, you can't buy a joint with less than 18 milligrams of THC. So you can purchase joints at the store, at the dispensary, but you can also purchase joints on the streets. And sometimes what we're seeing is these joints are called dippers, and the people who are selling them will dip them in methamphetamines or opiates, cocaine, to make the joint have more appeal. But if you buy a joint in Colorado and smoke it, the equivalent is the equivalent of smoking 18 joints from Woodstock, and you're doing it all at the same time. So there is no reduction in concentration, and I don't think you're going to have a reduction in harms by increasing the concentration so much. We can go to the next slide.
But you said you can't buy marijuana with less than 18% THC. So that's on the low end. So when people say that, you know, marijuana is a natural product and, it's right from God's good earth, that it's grown from the ground, they're not telling you the whole story because of the way it's processed with these chemicals.
Correct. This is very ultra processed product. And I have people who tell me they smoke 5 grams a day. And why? Just simply because they can. It's legal and they can smoke that much. Or 2 grams a day, and that's 2,000 milligrams. We can go to the next slide. So these products are concentrated, and they've been made in all kinds of products. We have edibles, topicals, smokables, some products that the general public doesn't know about, including marijuana-infused tampons. We have, down on the right, lower left side, we have inhalers that are designed to deceive so that people can do an inhaler of marijuana. You can have marijuana energy drinks, patch, alcohol-infused marijuana.